Hello, I am Susanna Park. I am a practicing ophthalmologist who treats patients with retinal conditions. As such, it's a pleasure for me to share with you an area of research I have been involved in for 15 years, and that is the potential use of stem cells in our own body as treatment for vision loss associated with retinal degeneration. The retinal degenerative condition of interest is retinitis pigmentosa, a progressive degenerative condition that starts with loss of peripheral vision and night vision, often in childhood, leading to complete blindness in both eyes, often in young adulthood. To date, there is no effective treatment. Retinitis pigmentosa is a rare condition that affects 2 million people worldwide, and there are 2,000 new cases diagnosed per year in the United States. Although this is a genetic condition, in a majority of cases, there is no known family history. To date, the only treatment we can offer our patients is nutritional supplementation with vitamin A palmitate, which has a very modest effect on disease progression and does not stop or reverse vision loss. In addition, there are potential serious side effects. Therefore, research is being done using gene therapy or stem cell therapy for retinal regeneration. In fact, the first gene therapy approved by the FDA was that for a very rare form of retinitis pigmentosa associated with a specific gene. Unfortunately, there are over 100 different genes associated with retinitis pigmentosa and many more yet to be identified. Regarding stem cells, various companies have developed embryonic or fetal stem cell lines for retinal regeneration, but this area of research is early in development. We believe we can use CD34 positive stem cells in our own bone marrow for retinal regeneration. These cells have been used for decades for bone marrow transplantation to treat leukemia or lymphoma. Therefore, there are established protocols for stem cell isolations, and the cells have been well characterized. More recently, CD34 cells have been found to be natural repair cells in our body, and clinical trials have been conducted in patients with heart disease, showing that local infusion of these stem cells is well tolerated with potential advantages. We aim to harvest these repair CD34 cells from bone marrow and inject them directly into the eye, as shown here, in order to maximize the repair potential of these cells on the retina. The advantage of using CD34 cells is that you can use your own stem cells, which is safer than using embryonic or fetal stem cells. In addition, based on the known mechanism of action of these stem cells, the cells can be used for broad clinical applications. The treatment may not be limited to retinitis pigmentosa. For a new treatment to become standard of care, years of clinical research are conducted for various phases to obtain enough safety and efficacy information for the Food and Drug Administration. However, by using an established treatment like the CD34 cells for a new indication, that is retinitis pigmentosa, we can dramatically shorten this timeline. We have already conducted extensive animal research showing that CD34 cells can be safely injected into an eye with retinal disease, and the effect was protection and regeneration of the damaged retina. In addition, we obtained an investigational new drug clearance from the Food and Drug Administration and completed a phase 1 study showing that it is feasible to inject your own stem cells into eyes with retinal degeneration without any major safety issues. Currently, we received funding from the National Eye Institute and is conducting a larger phase 1-2 study to obtain more safety and efficacy information regarding the use of your own stem cells in eyes with vision loss from retinal vein occlusion, which is a very common cause of vision loss. In addition, We have started a larger phase 1/2 study to evaluate the stem cell therapy for retinitis pigmentosa. For the proposed study for retinitis pigmentosa, we aim to enroll 8 participants, and we have already enrolled 3. All 3 tolerated the treatment well and noted some visual gain. For the 5 additional participants needed to complete the study, we need $60,000, the budget which can be met with the help of CureAccelerator. This interdepartmental research at University of California, Davis involves our study hematologist, Dr. Betty, who performs the bone marrow aspiration, our good manufacturing practice laboratory director, Dr. Bauer, who performs the stem cell isolation, the director of stem cells at UC Davis, Dr. Jan Nota, who gives scientific advice, and myself. I am the study ophthalmologist and the principal investigator, conducting the injection of stem cells and examining our patients. The goal is to complete the proposed phase 1/2 study, and if the results show safety and efficacy of CD34 cell therapy in patients with retinitis pigmentosa, we can validate the off-label use of this cell therapy such that the treatment can be available to our patients within 2 years. The ultimate goal is to improve the vision and quality of life for millions of people with retinitis pigmentosa or other degenerative retinal conditions. Thank you.